guys are here. We've been looking forward to this for a number of weeks. And what we want to do is let you know a little bit about our story and let you know why we're here and how you're going to get to make a difference in the world, okay? So let's first talk about something that you may or may not know about the world. What do you think that's a photo of? What do you think? Yeah, so we're seeing at night what the Earth looks like. And what do you notice there? Go ahead. Yeah, not everybody gets the same amount of light. Do you see that? So it turns out that 1.3 billion people in the world don't have something that we use every single day, electricity. And if you look at the world, there's certain places that have a lot less than others. Can you tell which continents have less? Africa, that's right. So Africa, do you want to go up and point to Africa for those who don't know? Yeah. So Africa has a lot less. And if you remember, today we're going to have a day of service for Africa. And we'll be trying to do something to actually help to bring a couple more lights to that map. So what does it mean to be living in a place where you don't have a lot of electricity? It means that maybe at home this is the only light at night, or maybe there's just a candle, or maybe there's no light at all and you just go to sleep early. I want you to imagine right now that you're living in one of these places. And imagine that you have a mom who's going to have another baby. And your mom's trying to have her baby at home, but there's no light in the house, she's not in the hospital, and she's been trying to have a baby for a long time, but the baby isn't coming. What do you think she should do? What would you do? Something's going wrong. What would you do if there was a medical problem and something's going wrong? What do you think? Call the ambulance. That's a good idea. And where would you want the ambulance to take you? Okay, so this family had the same idea, but they didn't have an ambulance because they were really poor. So they had to get someone to take the woman, the pretend mom, on a cart on a very long distance on a road, and it took them all day to get to the hospital. And when they got to the hospital, it was really dark. And now I'm going to show you what it looked like when they got to the hospital. That is the light, and the only light in a hospital that I've been working in northern Nigeria. And that's a hospital that delivers 150 babies every month. Do you think that would be a good place to have a baby? Why not? Can't see what you're doing. Because of that, a lot of women and other family members don't get the care they need. And women like these who are in northern Nigeria, instead of thinking that every time they get pregnant there's going to be a happy outcome, 1 in 22 women will actually die from a childbirth complication. And they have all different types of problems: bleeding, infections, blood pressure problems, or obstructed labor, which means your baby's just too big to fit. What do we do in this country if a baby's too big to fit? What would you do? I heard it. What? You do a surgery, a C-section. But can you imagine if you were trying to do a C-section in a place where there wasn't good light at night? That would be really difficult. So I'm going to show you a little bit about what it looks like inside the homes of some of these people that use these hospitals. This is inside the home compound in northern Nigeria, where they actually can have more than one mom. Families can have 4 or 5 moms, and they all live together with lots of children. And this is kind of what it looks like at home. They don't have running water, they don't have electricity. And if you're a boy in these communities, you might be lucky enough to get education. And these kids are studying outside, they don't have a real school. But if you're a girl, you might not even be able to go to school. And these girls are being told to do something called hawking. They're selling things for their moms, so their moms can have a little bit of money, so their moms can buy a few things, and they don't even get to go to school. And these girls are about 12 or 13, and the reason I show this picture is that in these countries, very often, these girls are just about the age to do what? What do you think they're going to do? Anyone have an idea? They're going to get married soon. And what do you think comes after getting married in these countries? What? Children. So these girls are not very far off from having babies. And do you think it's really healthy to have a baby when you're this age? It's not so good. So they can have a lot of problems, and that's part of the reason why there's so many deaths in these countries. So this is the hospital that I went to work at about 5 years ago in Nigeria. And it doesn't look too bad on the outside, but I'm going to show you now what it looks like inside. This is the ward where women are giving birth. And this is actually the labor room. And those tables on the right side are where they would go to have their babies. And I went there and I was watching what was going on and trying to understand what it would be like to have a baby there. I didn't tell you what I do for my job. You know what my real job is? I'm a doctor. And I deliver babies here, so I knew what it was like in my country, but I wasn't sure what it was like in northern Nigeria. And then I saw that when they did C-sections, and this is a woman having a C-section, do you notice something about that light on that's over the table? Is it on or off? Why do you think it's off? There's no electricity, and this is in a big hospital. And this is during the daytime, but I went to a surgery at night, and guess what? The light stopped working then. And the only thing they could use was my flashlight. And I was really upset about it. And so I ended up writing to my husband, the man who was standing here with me, Hal, and I said, Hal, this is a big problem here. They don't even have electricity to do a surgery. And Hal said, I teach children all about solar electricity. Maybe we can create something to help people in Nigeria. And so I came back and we started an organization that's called, can you guys read it? We Care Solar. We Care Solar stands for Women's Emergency Communication and Reliable Electricity. Much easier to say We Care. And what we did is Hal designed solar electricity, which you're going to learn a lot about today, with solar panels that bring light down into a battery that stores the electricity so that at nighttime there can be lights and other machinery that's used. I didn't know anything about solar electricity then, just like a lot of you may not know about it. And I said to Hal, can you give me a little kit that I can take in my suitcase to show people there what solar electricity is about? And I said, please make it really easy because I don't really understand solar electricity. And so Hal packed a few things in a suitcase, and that's a picture of me opening it up and showing it to the doctors in that hospital to give them a demonstration of solar electricity. And then the maternity ward went like this, and we brought in big solar panels, and they had light. And the operating room went from this to this, and we brought in something called a blood bank refrigerator to keep blood cold, so if someone was bleeding, they could get a transfusion right away. And in that hospital, the maternal death rate, the number of moms dying every month, went down by 70%, which meant a lot of kids got to have moms that didn't die. So that was a really cool thing. And then there were lots of other people that came to me and said, why are you only helping the big hospital? We don't have light either. And they took me to their clinics and I saw that they didn't have electricity at all. And so Hal would make more of those kits for me to bring every time I would go to Africa. So I would bring them the solar panel and a battery and things that you'll be learning about today to this clinic, and then to this clinic. And then you know what happened? Somebody wrote about us in the newspaper. And the next day we got requests from all over the world. You know why? Because so many places didn't have electricity and they wanted a solar suitcase as well. So we started sending them out. We sent them to countries I had never been to, Rwanda. And then, do you remember what happened a few years ago in Haiti? There was a big what? Earthquake. What do you think happens to electricity during an earthquake? Goes away. So we sent them to Haiti. And then we sent them to Asia, to places where people carried those suitcases on their backs and went into a jungle and brought light so that women could give birth with light and burn. And then the suitcase got much more sophisticated. Hal worked with an engineer, and this is what it looks like now. And there's one of them on the back, a yellow one that you can look at lunchtime. and we'll show you those. And then we brought them to clinics. So here's one in Sierra Leone. And we brought them to operating rooms, and this is a light in Uganda. And then we would teach people all about solar. Here I am teaching in Nigeria. And we would teach people to put the solar panels on the roof. And then they would teach other people how to do it. And we have a whole community of people around the world that are bringing light to maternal health clinics. Now, what is today? What's special about today? What is it? Martin Luther King. So who can read to me what Martin Luther King said? Go ahead, very loud.
Life's most persistent and urgent question is, what are you doing for others?
What are you doing for others? Do you know some of the people who have done the most for our organization are just like you? They're young people, they're teenagers. At the very beginning, there was a group of teenagers that had a rock concert to raise money so we could bring a solar suitcase to Africa. And then there was a student in Sacramento that started a club called We Share Solar. And then people said, can't we build the solar suitcases? And so students started making them in Detroit, in Elk Grove, which is California. And after the Haiti earthquake, one club made about 10 of them. Do you see them there on the ground? And then in Colorado, some teenage girls made some, and they decided to paint theirs red and pink polka dot. And even close to here, Monterey, there's a teacher in this room who's actually right behind you guys, Alan Jensen. You want to wave your hand? He taught a group of students to make solar suitcases that got to go to 3 different countries, and he can tell you about that a little bit later. And so we decided, let's make it a really special program for kids, and we're going to call it what? We Share Solar. Can you guys say that? We Share Solar. And We Share Solar is all about you getting to make a difference. And today you're going to come together to learn to make solar suitcases. If you would like, raise your hand if you'd like to do that. It's only if you want to. Okay, so some of you want to. Anyone who wants to gets to make a solar suitcase. Would you like to see where they're going? Okay. So here's Sierra Leone. This is an area where girls do get to go to schools. They're all wearing uniforms there. This is what it looks like in their room. Do you see any electricity? No. So one of the solar suitcases is going to go to light up a school in Sierra Leone. And do you know what this is? This is an orphanage in Uganda. And the reason these children are orphans is that their moms and dad died of something called AIDS. So they don't have moms and dads, and they're living together. And you see that we are in their schoolroom. Do you see any electricity? No. So that's what another couple of solar suitcases are going to go to as well. And I'm going to tell you one final story, and then you're going to get going on your project and meet Hal. So this is a story about what one solar suitcase can do. In this village, which is in the DR Congo, the man in the orange t-shirt is actually a doctor. And he took a solar suitcase there last Thanksgiving. And the day that he got there, there was a very bad disease outbreak called cholera. And cholera is a disease that makes you very, very sick, and lots of people can die from it. In fact, in the past, he said, when cholera outbreaks would occur, about half of all the people who got sick would die. But this time he had a solar suitcase, and for 30 days he used the lights from the suitcase to shine a light on the patients so that he could start their IVs and give them medications and monitor them. And guess how many people died this year in the village? 0. Nobody died. And the people in the village got so excited, they said, let's make the health center our community center, because no one had electricity at all in that village before. And now everybody comes there at night when they want to have light. So even one little suitcase can make a lot of difference in the world. Now sometimes problems in the world seem insurmountable, and it looks like there's no way out. But sometimes it just takes looking at things from a different perspective to realize that the solutions are not so hard. And today we're inviting you to be part of the solution, to have a chance to serve other people, and do something that we know will really light up lives around the world. And you can join teams like this who have been making a difference. And we'll be around the whole day to support you, and thank you for your